Hello, I'm Maria Hall Brown, and this is LA Currents. Well, currently 1 in 140 people in Los Angeles get COVID, and the stats say that it might even go to 1 in 100 or 1 in 70 if we don't take some action pretty quickly. There are some very simple things that we can all do, and here to give us some really good information is Joanne O'Brien, the Medical Services Division Administrator. So nice to have you with me
Thank
today.
you for having me.
I always learn so many really great things from you.
Thank you.
So right off the bat, we're not in a good space right now, but in general, what's happening in Los Angeles?
Well, we've seen a surge in the number of positive cases and also a surge in hospitalization. So that's where we're starting to get concerned, and that's where we're sort of rolling back. And I know we've heard our governor and our Mayor Garcetti talk about sort of the dimmer switch and sort of going back. It can kind of go forward and go back. And when we see this increase in cases, we want to kind of dial back because we don't want the infection to spread and then also impact the hospitals.
So the hospitals that had kind of, started to go back to normal, and even some of the emergency spaces that were going to be unemergency spaced have actually been reactivated.
Correct. So they're sort of waiting for the surge. We still have hospital beds, but they're preparing for that because they can see the increase in the numbers.
Well, the best way to mitigate this problem is to just not end up with people in the hospital. And there's some very, very simple things that people can do. And obviously the most important part that has been determined is wearing a face covering. But that seems to have inspired a little bit of resistance.
Correct.
So let's go ahead and let's do some basics about why face coverings are so important. How do they help?
Face coverings, when you talk, when you're just normally talking, your nose and your mouth put out little droplets. We know that the virus is spread in those droplets. And just talking back and forth, I'm standing next to you, and if you have COVID and I don't have a mask on and the person talking to me doesn't have a mask on, I'm breathing that in. And if we call it a viral load, if you get enough of that virus in you, you will become sick. So if you just simply cover your face, and when you cover your face, it needs to be your nose and your mouth, that takes away that spread by almost 50%. So if you have two people with a face covering on, you've just sort of knocked it down. And then in addition to the face covering, if you stay at least 6 feet away, you've kind of taken away the risk. So it's really simple steps, very simple steps.
I've seen a lot of people wearing their face covering and their mask, but sometimes they put them down below their nose. I'm sure that's for physical comfort, but are you completely eliminating all of the benefit of wearing a mask if you're not wearing a mask properly?
Pretty close to it. Because when you're talking, you're breathing, and those same droplets come out of your nose, more out of your mouth. There's, you've mitigated or taken away some of the risk, but when you don't cover your nose and your mouth, it's not the proper way to wear a mask. And sort of when people talk, they'll put the mask down so you can hear them, but that's when you need to have it on most, is when you're talking.
Right. Well, I have a whole bunch of masks here, and does any of it matter? Does it matter what they are? I've got, the disposable one that you see around a lot. I've got, a custom cloth one that was designed for me by a dear friend. I've got, a very basic cloth one. And then I've got one that's called a KN95, but this is not obviously the medical one with the filter.
Right.
This is just a more.
So
So does any of this matter?
they're all good. Any face covering is good. For sure. They're starting to do some studies. The cotton masks that have sort of more than one layer are the best. So that's actually the homemade ones with the layering is really, really effective. But they're all effective. The paper mask should only be worn once. Throw it away.
Okay.
Don't use it again. When you're taking your mask off, take it away because the front of your mask is considered to have the virus on it. It's infected. So when you remove it, take it away, throw it away, wash your hands. When you're done wearing your mask for the day, if it's cloth, you need to wash it.
Every
it can
day?
be hand wash. Don't rewear it the next day. So sort of line them up. Here's Monday through Fridays, and you can wash them if you're not going to go anywhere in the weekend. So just don't reuse them day after day and consider the front part of it to be infected. The KN95 is not the medical grade one, but
No.
it kind of has the same numbers. And those masks are a little more sturdy than the blue mask there, and you can actually put those in like a paper sack, put them over on the side, and then reuse them until they get wet or soiled. So those are a little bit more durable than the blue surgical mask that you have.
Okay, and also, not only do you need to wash them, but they do have a lifespan, and you should not wear them after, if things happen to them.
Correct. If they're torn, they don't fit you properly, they stretch out. And the other thing I wanted to say too, when you're wearing a mask and you feel the need to remove it so someone can hear you, you're touching the front of your mask, which is considered to have the virus on it, and then you're touching yourself. So when you have a mask on, you shouldn't be fidgeting with it.
So if you're going to do anything behind your ears.
Correct.
All right.
And then away. Yeah.
Okay. So there are people who are not wearing face coverings. But beyond this, there's also just, before I move on, it doesn't have to be a mask that's been made by someone else. It could just be something that covers. Does it matter how low it
Absolutely.
goes or
Yeah.
how it fits or anything like that?
The bandanas I've seen out, anytime you cover your face, you're helping another human being. You're helping yourself. It prevents the spread. And why masks are so important is because we now know a certain percentage of the population doesn't have any symptoms. They don't know they're sick, but they're spreading. They're sort of called super spreaders because you're out and about and you feel fine. And if you're one of those who chooses not to wear a mask, you could be infecting other people. Or you could be picking up that and become a super spreader and then bring that home to your loved ones. And where the disease or the infection affects different people, but it affects all ages and can affect people to the very severity of actually dying, to being on a ventilator. And they're finding out that those individuals that have been on a ventilator have long-term health problems they're starting to see. So it's not like you're off the ventilator and you're fine and you were pre-infection, or you could be no symptoms at all or just a mild cough. So it's really hard. They're trying to trend that right now. We know that if you have other disease processes, like you have diabetes, asthma, high blood pressure, cardiac disease, you're more at risk. They know that, but this infection can affect anyone at any age.
I'm going to go back to masks in a minute, but I do want to follow up on what you're saying because there's so much is being learned. It's still very early in our understanding of the virus. It may feel like it's been forever, but in terms of medical understanding, it's not that far in. But we have learned, like you said, asymptomatic. We have learned, how much viral load changes how you are impacted by the virus. We don't know yet, I imagine, whether antibodies are a long-term solution if you've recovered. What are some of the other things we're learning? I know we've learned that symptoms are different amongst people and response is different. So you're the expert. I'm just tossing things out here.
The symptoms can be so varied. I really spend a good part of my day talking to people who have positive COVID tests. And it can be from, I didn't know I had it, to I'm so tired I couldn't lift my arms. I'm so short of breath. I'm coughing, back pain. Sometimes there's diarrhea. There's rashes. We've discovered this, they call them COVID toes, where you get these red toes. They're bright red. Are they going to stay that way? We don't know. So
circulatory issue or literally
I
just
think
skin?
it's related to the inflammation because your body realizes that there's something foreign, so it comes to the rescue. But sometimes it comes to the rescue too much, and so your responses are too great. And that's where you see the inflammatory syndrome, like especially in children. So, and that, which is kind of showing up, that's the other thing we learned later on, that sort of sequelae is showing up weeks later after the child had the positive COVID, recovers, and then that shows up. And I think that sort of has to do with their immune response.
Because for so long, children seem to be the safe part of our population.
Correct.
But now we're
Yeah.
learning that they are getting it, but they are manifesting it in a different way.
Right, correct. Their immune systems are a little different than ours. You know, they're going to react differently. They're a little immature, so we are seeing differences, and children aren't completely exempt from getting this infection. They are at risk as well.
The deaths that are being attributed to COVID-19 may not appear to be COVID-19 on the surface. So how is that being determined? Because say somebody who is in a fragile position dies of a heart attack, but it might be COVID related. Is that not true? Is that not
that may happen, and it may get missed. We don't know. I think most of the facilities now are just testing right off the bat because it's just so community based. For those that became the sickest that were in ICU, their intensive care unit are staying in the intensive care unit longer. They're staying in for weeks and on a ventilator for weeks. So your health has been so compromised when you've been laying in a bed on medication, on sedative type medications. And so when they finally get off of that, there's a long recovery road in terms of just walking, taking care of yourself. They're starting to identify cognitive issues where they're not thinking as clearly, they're forgetting things. And whether that's related to the disease, I think it's too early, or just because of all of the medications and how sick they were. And hopefully it'll come back in time. But there's hasn't been a lot of literature on that, but there's a lot of people at home that are sick, that aren't counted, that aren't in the ICU beds, but they're still recovering. You know, they can't go back to who they were before they got COVID.
And there is some suggestions for people that are at home that are sort of managing it, that don't require hospitalization, to just make sure that they keep their lungs active and healthy, and you just don't lay prone for a long period of time, that you should be aggressive even though it might be uncomfortable to keep your systems going. Is that true?
It's absolutely true. You have to walk every day. It makes you breathe deep. You have to sit up. You have to use your muscles. It's really true. You don't use them, you lose them. It's absolutely true. So, and that's part of, they'll have to do physical therapy, have family members help them, but it's a long recovery, absolutely.
Okay, well, let's go back to not getting it at all. And the idea of wearing a mask. A lot of cities now, or some cities I should say, are saying that you will be cited if you do not wear a mask outside. I thought inside was sort of required, outside because of just the nature of being in an outside environment, it's not as necessary. Where's the line where you should wear a mask, always wear a mask, or feel a little bit relaxed about not?
The only place you should not wear a mask is your own home, when you're around your own family members. And when you walk outside of your house, put your mask on. It's one of the few defenses we have. And as we talked a few months ago, this is a novel coronavirus, which means it's new, and some things have not changed. We have no immunity to it, and that's why so many people are getting sick. The treatments we're discovering some, but are very few, and we have no vaccine. So wearing a face covering protects you, and it also protects other people. So I think just putting on a mask shows you care, and everybody should care about each other. And it's really simple. It's very simple.
So out walking the dog.
Wear your mask.
Okay.
Yeah.
When should you give yourself a respite? Because they're not the most comfortable after a period of time. I mean, they're tolerable for a while when you're doing your grocery shopping, when you're walking your dog, etc. When should you, just from a health standpoint, because I know a lot of the resistance is, you're breathing your own exhale. That's not so good for you. You need to breathe in fresh air. When should you give yourself a little bit of a respite? It's
okay to have a mask on, and you're not going to hurt yourself by breathing in your own air.
CO2.
Right. It's okay. That's not a harm. I would be very honest with you. If you're doing vigorous exercise, it's going to be hard to wear a mask. And so, like when I'm out in my neighborhood and I'm exercising, and I won't have it on, but if I see someone coming in the other direction, I'll put it on out of the courtesy for that person. So you can work around. I think our world now, we just have to do things differently, but we can do things. Just have to look different. Yeah.
I know that there is a resistance from people who feel as if it's against their civil liberties, but then there's also the sort of laissez-faire idea of, well, I'm too young, I'm not going to get it, this is silly. How do we combat that process? And I don't even know if there's an answer to this. How are we getting the message across to those that are asymptomatic, to those that may not think that there's anything that's going to affect them? How do you get through to them?
I think with education, messaging, I think the more information you provide to people, they can make choices. But masks do work. They work. I think when you sort of say there's cities mandating and they're finding, I kind of go to seatbelts. You have to find people so they ride in the car safely. We fine people for texting while driving. So it's sort of akin to that. We have to keep people safe and the community safe. So we do need to tell them to wear masks. We need to tell people not to drive when they drink, things like that. So it's sort of an analogy.
You'd think the common sense would rise to the surface, but I actually read that if 80% of the population wore a mask, it would be a lot more effective than these safer at home and lockdown
I actually
scenarios.
read that same information, and I would think it's true if you just sort of think it through. And there's lots of things on the internet that show, when you're talking, how things sort of spray out and how much it is, and then how that changes when you put a mask on. It's remarkable. So if everyone did that, then the virus wouldn't have anywhere to go. It's having a blast right now. It's just looking for another host. So if you kind of knock it down, it'll go away.
Let's talk about the virus having a good time spreading around and what will hurt it. Because again, we all have these now. And one of the things that you told me when we spoke at the very outbreak of this was hand washing, of course, is the best thing you can do. But it's not just the hand washing, it was the friction. So are we still feeling good about the friction component?
Absolutely. The soap, you have to have both. Soap, hot water, friction, it washes off. You have to get all parts of your hands, your thumbs, fingers, your fingernails for 20 seconds, or the happy birthday song. It's kind of, everybody knows that.
Everyone knows that.
Yeah, and then when the water is running, you get the tissue, shut the water off with the tissue because you don't want to reinfect your hands. Dry, off you go.
Okay, and now you don't have a sink in front of you with any kind of soap and water, but we all now have wipes. We have lots and lots of wipes. We have wipes for surfaces, we have wipes for ourselves. Does it matter what wipe you use, just if you're coming out of the grocery store and you just, touch the cart and you want to, and does it help to also use that friction with the wipes?
Absolutely. And let it dry on your hands. Don't put it on and then wipe it off. Put it all over your hands, let it dry. And then it's effective as long as it's 65% alcohol or more.
Okay, so if you just have your nice little baby wipes around, do they help at all, even though they have no alcohol in them whatsoever?
No, not at all. They're just going to get your hands
smelling nicely.
Right.
Okay, that's great. All right, and it has to have alcohol.
Correct.
What about the ones that just say antibacterial, but there's no alcohol in them?
I would need to research that, but I would go with the alcohol base. That's kind of what the CDC is recommending, at least 65% or more.
Okay, so I got a 75% alcohol, and I've got this is alcohol-free, but it's an antibacterial.
And I would need to see what exactly, I would be a label reader.
Exactly.
And then just, lots of products are out there, and it would be impossible to memorize every one of them. But I would go to a reputable site like the CDC, and they do have a list of what's good and what isn't.
Yeah, this is benzyl chloramine chloride. Okay. I'm not even going to try to pronounce that. All right, so this is my winner. This is a 75% alcohol wipe.
That's awesome. And you can see that it has on the corner the FDA recommendation. So that's always good.
All right, and then I don't have my wipes with me, but I do have some spray, or I do have some, gel, just as long as it too is at the alcohol plus.
Yes.
All right.
Yes.
Interestingly enough, I need to make some adjustments in my world. I thought I had it all handled. Interesting. So, okay. What do you feel about the new acrylic face coverings that you're starting to see people wear?
The face shields really are used primarily in a medical setting, and the virus still don't have your face and mouth covered, and there's nothing precluding that virus from coming out or going in. You still need to have a face covering.
Really?
So yeah.
Okay.
Yeah. And we wear those in the medical world when we're doing something with a patient that may cause some spray. Whatever that is. Like, for example, a doctor that's putting the tube down to help somebody breathe. The secretions may come out. You're doing some kind of surgical procedure, or where there's a chance of something splashing on you. That's when you would wear that.
So it's the fact that they're open at the bottom,
Right.
is
Yeah.
basically
Yeah.
eliminating
Yeah.
their
Right.
efficacy.
Yes.
Interesting, because I've seen more people just at the store wearing those than I had a couple weeks ago. So the cases are increasing at a very rapid rate. I would assume mostly because asymptomatic people are passing along the virus without even knowing it. But once someone has been tested and they have actually been determined that they have it, now there's this whole issue of contact tracing. How is that working, and how is it going to help?
This is sort of an old method. Public health has used this for a very long time. For example, with tuberculosis. Somebody comes down with a communicable infection, something that can spread to other people. You have to figure out where they have been and who they've been with. So when we're doing this contact tracing, we ask, for example, in the work setting, when was the last day you were at work? Who was near you? Did you have a face covering? Did everybody else have a face covering? What's going on at home? Where have you been? So you start to do this circle of who they were around immediate, longer than 15 minutes.
Okay,
Less
that's
than
the
6.
line?
Yep.
Okay.
The CDC has defined that as 15 minutes at least without a face covering. So, you're at the bar talking with a friend, you're talking back, well, you're there for 2 hours. That's an exposure. Neither one of you had the face covering on. You spent time together, and then your friend's like, oh, goodness, I'm positive. So that one person, not only the positive person, now we're talking to his friend who isn't positive right now, but has been exposed. So we have to isolate that person for 14 days. You need to go home. Don't be around anybody else. So that's the other responsibility. If you have been exposed, you also need to remove yourself away from other people, because now you're exposed and there's a chance that you may become positive. So we have to wait it out at least 14 days.
Has there been any variance in that 14 days? Because that seems to be the 2-week mark has been what we have learned from the very beginning. So we know if you're going to become ill, you will become ill in those 14 days.
Within 14 days.
Is there a
yes.
variance in there at all?
There absolutely is. A lot of people will start to feel symptoms on day 5.
Okay.
So you could test somebody on day 5 and know what's going on, and 60% of the time they'll be positive. But if you wait till day 11, you're going to go up to about 90% to see where they're at. So you wait it out a couple more days, to 14, and then that's sort of safe. If you haven't become positive within those 14 days, then you're going to be okay.
And the way to sort of predetermine whether someone may or may not be sick, obviously at first it was temperature taking.
Right.
And that's been, not everybody gets a temperature, so that's not reliable anymore.
Correct. You're absolutely right. It's just one tool. And my clinic, we actually have caught a couple people that had a fever, so it helped. It's one tool, because this is so new and we do have very few tools. But we know now there's these asymptomatic and also pre-symptomatic. We also know that a person will be infectious 2 days before they get sick. So 2 days before they even know they're sick. So we also have that. So. And that's why it spreads so easily. It's highly contagious.
How do we feel about pulse oximeters?
I think for people that are at home and sick, for example, I talked to a person yesterday who said, you know, I can't breathe in deep. So we had a conversation about, can you walk across the room? How do you feel like
Can you hold your breath for
can't,
10
right,
seconds?
Can you? And so she said, I'm gonna order one. And I think if people have tools to make themselves feel good and monitor their health, I think that's fine.
Yeah.
Yeah.
Because I know there's
Yeah.
a psychological aspect to this. We bought a pulse oximeter just so that I
Unbelievably
could just go,
Yep.
oh, 99, I'm good.
Yep. And that's fine.
Yeah.
You know? Yes, absolutely.
All right. A lot of places are having to scale back, but a lot of things are open. And one of the things that people are considering now is whether they are going to travel, whether by car or plane, or whether they're going to stay at a hotel. Has there been any kind of sense of all of these disinfecting efforts at a large scale with large companies have been put into place? Are there any things that would you feel comfortable staying at a hotel?
Not yet.
Not yet?
I'll be very honest. Mm-hmm. But if you have to, there's a lot of people who have to travel and need to. I think if you wipe things down, assume that they have the virus on them, I think you'll be okay and be a good hand washer. Mm-hmm. You know, I think the hotels really are doing a lot to keep their facilities clean.
Well, even
think
keeping
so.
the rooms
Yeah.
empty for a long period of
Right.
time. I mean, have we learned anything about the
Yeah.
shelf life
Yeah.
of a virus on a surface beyond what we knew before?
Around 7 days. There are studies that say 3, but even if you kept a room empty for 7 days, you're okay. You know?
7 days.
Yeah.
It could
On
literally.
some surfaces, yeah.
Is there a particular type of surface that it likes to hang out waiting for us?
Plastic and cardboard seem to have the longest shelf life, where
Wow.
something's hanging out on it. That's why you wash your hands after the grocery store.
Yeah. And don't touch your eyes, don't touch your nose, and don't touch
Right.
your mouth. It's
Right.
not going to go in through your ears. It's not going to go in through your chin. It's going to go in through your eyes, nose, and mouth.
Correct. Yes.
Okay.
Yes.
How many masks do you have now?
I have a lot. Yeah, I have people that are making them for me, and I have, you know, the medical ones. I also have just the cloth ones. I have a Dodger one, of course. So
Good job.
yeah,
Good job.
yeah.
I think that's actually kind of fun. If we
It is.
maybe if we skewed this to, you know, making it a fashion statement, or maybe if we skewed it to adding a little bit of brevity to
Yes.
it, or
Yes.
levity, I should say. Yeah, no, I would think that. Well, I cannot thank you enough for all of your information, and definitely am going to repurpose some of these wipes to not necessarily. So anything, let's just kind of overview. Always wear a mask over your nose and mouth, no matter where you are.
Right.
Still, alcohol is your best bet,
Yes.
over 70%.
65%.
Over 65%.
Yes.
Okay,
Yes.
okay.
So
And wipe everything down, and keep in mind that you may not know you're sick, but you might be sharing it with others.
take care of each other.
Take care of each other.
Yes.
It seems
Yes.
very simple.
Yes.
And it seems as if, you know, that would be something we could all do very easily.
Yes. Thank you so much for having me.
Well, I cannot
Important
think.
information.
And if people
Yeah.
want more information,
Yeah.
that's an critical part of
Yeah.
this whole thing. Where's the best source for people to get information, particularly here in Los Angeles and what's happening in the world?
The City of LA, if you just cityofla.org, it'll guide you to that. It'll go to the main page. I know the mayor's office has really done a really good job of keeping the information updated. The CDC, World Health Organizations. I would go to reputable organizations.
Because there's a lot of misinformation
There
out there.
is, and it changes very quickly now. One of the physicians I work with says, I love, he uses this analogy. He said, we're building the car and driving the car at the same time.
Yes.
So it changes quickly. You might hear the medical community say one thing one day and then contradict. It's just because we've learned something new. If you go just to lacity.org, it's just a wonderful site, not only to provide you with information that's new, but also to resources, because there's a lot of people that need sort of extra resources because things are opening, closing.
You feeling it's going to be good? We're all
If
gonna be
everybody
okay?
does their piece, we'll be okay.
All right. Well, I can't thank
Yeah,
you enough.
yeah.
Thank you for all of this updated information. I'm sure we'll talk again because this is a moving target. Hopefully, next time we talk, we'll be talking about all the positive strides the city has made.
Yes.
All right.
Look
Thanks
forward
much.
to it.
And that's a wrap on this LA Currents. Stay safe.